Hello, I'm Glenn Preminger, current historian of the Endourological Society. An initiative of the Society's History Committee has been to highlight the Society's history through its international leaders. One of the basic attributes of industry leaders is their ability to foster innovation. By encouraging creativity and new ideas, a forward thinking leader drives innovation within their organization. Who better to review the history of endourology in Asia and the establishment of the Endourological Society in India over 35 years ago, but Mahesh Desai, who has made a career of minimally invasive urologic surgery and endourologic education, not only at his own institution or within India, but across southern and southeastern Asia and the world. It is my pleasure to introduce Dr. Michael Wong from Singapore, founding president of the Asian Society of Endourology, who is currently principal director of the Asian School of Urology at the Urologic Association of Asia, who will interview Dr. Desai. Dr. Wong?
Hello, my name is Dr. Michael Wong. I'm the 1994 Endourological Fellow of Professor James E. Lingerman in Indianapolis. And today, I have the privilege and pleasure of not just introducing one of the true legends of endourology, Professor Mahesh Desai from India. He is truly a world-class urologist, a true gentleman, and a friend for the last 25 precious years. Mahesh, it's so good to see you. And it's very important for the audience and viewers to really appreciate all your achievements as a urologist. But before we get into your journey of urology, could you tell us something about yourself? Let's begin by asking a very simple question of what drives you to get up every day to do a better job. So why did you do medicine in the very first place? And why urology?
Michael, it was very nice to see you, and I'm very pleased to discuss with you my lifetime journey. Michael, when we were young, it was our parents who decided what we will become at that time. So my elder brother was a lawyer, my second brother was an engineer, my sister was a classical singer, and they decided I will be a doctor. And so even though, I said, all right. But I wasn't so focused on that till the time I was in a pre-med, but I was a mediocre. Unfortunately, that time my mother had to undergo a surgery, hysterectomy, for a benign condition, and one of the best surgeon came and he did the surgery, but she had a complication, and unfortunately she died next day. And that time I heard I was young, I was only 15 years old, and the surgeon said this was a 1 in a million complication in my hand, and I thought it was a 1 in 100% complication. I lost my mother, but then I decided it was her wish, and it is my thing to study hard and get into the medicine, and then try to see if I can change the statistic. Nobody should suffer because of the complication of surgery. We must have enough training. Of course, disease is different, but for a normal surgery, one should be. So that's made, and I work hard. Next year, I got into medicine. I was 6th on the merit list, and that's how my journey started. After I finished my MBBS and MS, I got enough knowledge acquisition, but I thought I needed more training. And then I had maximum what I had. I had excellent teacher, Dr. Bode. But then he said, go to England, you will learn more. And I went to England, and then I was in a rotational job. And I came to the urology, and I was fascinated. the endoscopic surgery. That time we were doing an open surgery for the prostate, and here was the endoscopic TURP, which was a difference between the general surgeon and the urologist, and it was not available in India. So I said, let me do the urology because it was fascinating and it will make difference. It becomes a minimal invasive and a less complication than the open surgery. So that was my aim. So I become a urologist.
Tell us your journey. I mean, it must be fascinating just looking at your CV and all the precious gems that you have learned along the way. You have come from open era to minimally invasive to robotic. Tell us a little bit more about your journey.
Yeah. So it was in 1970 when I went to England and came back in 76, trained as a urologist, and then started my practice. But that what made the difference was doing an endoscopic. That was the only endoscopic surgery was a TURP for the prostate and the urethral stricture. You do urethrotomy. So. But then 80-90% was still open surgery. And at that time, I had opportunity. I was settled in Ahmedabad, but then I had opportunity to be invited by one of my very close friend, Dr. Desai, who was with me in England. He said we must have a institutionalized treatment because the private practice is very limited. And then he asked me whether I join him. I said yes. And in 1978, he built this institute, which is known as the Muljibhai Patel Urological Hospital in a place called Nadiyad, which was a little 50 kilometers away from Ahmedabad in a small rural area. And I joined that, and then we started serving the people. And then what was the most important? There was no dialysis, and the lots of stone patient with kidney failure. And then we had to do dialysis ourselves. But now we got 2 dialysis machines. And then we started doing the dialysis and then treating the stone together. And then people came with a kidney failure, and then we did a dialysis. And then what? And then he said, we will do kidney transplant. So 1980, we started a kidney transplant. That was the turning point because that improved our care of the patient, standard of the care in the patient. And this is what was very important. But then we had some hiccups. So we went to, that time we went to USA, both of us. I went to Downstead Medical Center to see about the ureteric reimplantation, how they do it, so I can avoid some complication. But at that time, I went to the SIU meeting in 1982 in San Francisco, and I heard Christian Chaucy and Peter Alkin talking about lithotripsy and the PCNL. Mind you, we had the maximum stone disease in India. Nearly 50-60% of our work was stone. And then we had mastered the open technique of inotrophic nephrolithotomy and everything. Till one, it's pyelolithotomy, and now is a minimal invasive surgery. And it fascinated me because morbidity was less. And then I started attending the Endourology Society. In the first meeting I attended was in Karlsruhe in Germany, where Dr. Arthur Smith demonstrated the instruments and the thing. And at that time, I went for a trip to the Switzerland where my friend Sushil Sanghvi was staying. And that time, he had undergone a PCNL for a stone in the kidney. 3 days back, and I went to him. And then for next 4 days, he was driving the car in the mountain and looking at his morbidity. I was absolutely fascinated because I could not give that morbidity to an open surgery. And then I was convinced that the minimal invasive surgery or endourology, especially PCNL, was good. So he introduced me to his doctor, who was a French doctor, and then he gave me the cassette of PCNL. And then I looked at that cassette for many times. And then we decided in 1985, I did a first PCNL. And I was the second person in India to do the PCNL. And then after doing PCNL, 14 PCNL, I went to Mainz in again Germany to see how I can improve the technique. In meantime, the puncture was very important. And then I thought that ultrasound was a way to do the puncture. And then I went to Denmark in Harlev Hospital to learn the ultrasound. And I bought the ultrasound. And in 89, 86, I started doing the ultrasound guided PCNL. Why I started PCNL, not lithotripsy? Because the lithotripsy was most popular. When I saw the Joe Sugara's paper of 1,000 PCNL, and he had a clearance rate more than 95% and a minimum morbidity. And I thought that was the most economical in an Indian situation. Technology was costly, but then we have to see the outcome was near 100%, and the complications were less. And then I thought PCNL was the most suitable for Indian situation. So I went for the PCNL, and that's how the journey started, PCNL urotoscopy. But still, we needed a lithotripsy. So in 89, we bought a lithotripsy. So, so that is how the endourology started in our places. And then because we had a tremendous volume of the stone disease, and then we adapted this minimal invasive surgery, and then we found that we could do an excellent job. And then we realized that we need to popularize it. We need to, more surgeon in India should use it, or in Asia, where the economical conditions were a little bit precarious, where you have to use this thing was costly, but then we planned to show it. And that was the turning point was in 89, when one of my friend came and said, Mahesh, you have so much work, and it will be criminal if you don't use this for teaching. And that's how we started teaching in 92. We got very recognized for the teaching. And when we had excellent teacher, Dr. Bapat, who joined us as a chief, and then we all become then teamwork, and then we started teaching. And today our center has become a teaching center for minimal invasive surgery. So that's the surgery. But with minimal PCNL, we got the name in a PCNL, minimal invasive surgery as well as transplant. And by that time, we had done more than 1,000 transplants. By that time, Michael, the donors were the live donor, and they were 70% were female, either mother, sister, or a wife. Because that was the social situation in India. And I felt so bad to give a big scar to the woman, especially even sister who are not married and things like that. It was not proper. And that time, the Ralph Clement showed in 1919 the laparoscopic nephrectomy. And Dr. Gill was with him, and then he learned, and then he started publishing paper on the donor nephrectomy. And once I met him, and they say, can you come to Nadia and demonstrate? He said, sure. And then he came in 1999, and he showed two laparoscopic donor nephrectomy. And it all went successfully. And then that we decided, let's do the laparoscopy. We learned the laparoscopy. From 2001 or 2 onward, we did all the donor laparoscopically. But then laparoscopically, we use it for every open surgery for an abdomen, for a pyeloplasty, for a nephrectomy, and then partial nephrectomy, then a radical prostate, and everything. And then we sent Mihir, my son. He also graduated in urology. He went to Cleveland Clinic, and then he learned the laparoscopy, and he came and taught us also. But he said that the next thing in the future is a robot. But then robot is very expensive. And then we waited for our base to build up, and then we bought a robot. Now from 2010 onward, we have a robot, and then we use it for a partial nephrectomy, cystectomy, and a prostatectomy. And we have a different department. So from an open surgery in 1970, we started with endourology, then laparoscopy and robotic surgery, and then we did. I do believe in technology. I think technology saves the life. And then I was so fascinated by technology that so many things I used. I did a HIFU, I did a tuna, and the ultrasound helped me quite a bit in doing this. So this is my sort of a short journey in urology. And today, from a 100% open surgery, which I learned, and now it is 98% endoscopic surgery. Only 1 or 2% is open surgery. That
Fantastic.
transformation I was lucky to see. And then I had students, and we have trained about 146 students now, and and even they themselves have become expert and innovative in this minimal invasive surgery. So we have been progressing from that point of view.
It's amazing because you are definitely one of the leaders in education and training. Tell us a little bit more of your educational journey. Talk about your stint as SIU president, where you were able to get training of African urologists as well, and some of the Asian workshops you've done. Tell us more about that.
After I attended the SIU into 1982, I got fascinated. And every AUA I attended, and I attended all the teaching classes, and then I learned, especially endourology, I learned a different thing, laparoscopic, and then I thought that, and then picked up all the surgery. So I thought that education is very, very important. And then once we started doing the education ourselves, we trained and invited so many people from abroad to do. You have come, and Katie Fu has come, and Glenn has come, and then we did exchange, and they demonstrated the thing. And then opportunity came, and one day in June 2000, Arthur Smith phoned. He says, Mahesh, can you do a video urology conference? Because Tolly was supposed to do it in Edinburgh, but there was some problem. Can you do it? I said, sure. When is it? He says, next March. So I had to do it within a 6-7 months period, And when I said, this is the opportunity to show what we do, learn from the others, because we would get the faculty. And then I selected Goa, and then I did it because that was the first international congress we did it in India, and it was a matter of pride for Indian urologists. And then we presented so many things, and we heard international faculty in it. Goa was a very successful. And then we become a very friend with Arthur Smith and Joe Sugura and all the people. Glenn also came. And then I bid for a World Congress in Endourology.
That was a beautiful meeting.
I got it in 2004. But that was a turning point in Indian urology. Because
Stone you're the driver.
Yeah, and that how I started. There's 2 conferences made me do lots of work. But in endourology, we did a live surgery from Nadia to Bombay, and we used the technology. And for the first time, the Mani Menon showed the robotic radical prostate from the Detroit to Bombay. And on all the Glenn and everybody, they came to Nadia to demonstrate the surgery. To the first time the live surgery was shown in WC. Then the end of the conference, Joe Sugura became a president. And then I asked him, I have saved about some money. What should I do? I thought I was supposed to give it back or something like that. He said, no, that is your money. And what I advise you, whatever you do it for your for a student, for a teaching and training. Not only in India, but in areas surrounding it. And that's how the Jairam Das Patel Academic Center we built up. And then we have a dry lab, wet lab, and we got approval for the animal lab. And then we started the training center. I think that was a turning point in Indian urology to have a training, a hands-on training on this thing. You don't go straight to to the patient. My aim was to make the surgeon very competent so they can practice and develop a skill in a skill lab, and then they can go to the open surgery. That was the 21st century. Ralph Clement was an excellent speaker, and I heard him about the training and teaching and training, and then I got lots of ideas from him. And then all the people, including, I learned from the Glenn. I run the flexible ureteroscopy, and he used to come and he used to teach, and we did it in a lab, and then we showed to the student and then do it. So this part of a training was very important to reduce the complication and improve the result. And then I was in Asia. I've been to Singapore, and we were together in the Asian Endourology Society, and we decided that we will demonstrate all this technique to the Asian student. We went to Myanmar first, and then did a workshop there. Then we went to Bangladesh. Then we went to Nepal. Then we went Nepal. Glenn Preminger came, and then we went to Kashmir. Then I went to Egypt. Then when I was a SIU president, I had to pick up one country in Africa, and I picked up Nigeria. And then I and my staff all together went to Nigeria many times and trained them. I went to Sudan, and they were, I mean, it was so pathetic in the sense that they were underprivileged and economically poor. And SIU and endourology, they both helped to develop the treatment part of it. And then we used to go, and then we made a deal with them to send two students, like from Egypt or Nigeria. Two students come to our unit, stay for 6 months and get trained in minimal invasive surgery, and then they go back and they practice. And that's how we try to build up. And all my friends in USA and Europe, they help to develop it. I'm also grateful to Glenn Preminger because with him, I learned lots of new technique, and they have a excellent result. And then we presented at so many forum, and taught it. So that's how the global. I think the motto was every life deserves the world-class care. That was the motto of our treatment. And for the JAPAC, the word was enter to learn and exit to serve. So that is how we do it. But I was lucky to have so many friends across the world who were joined from every country and that thing. So that was the one. And then my association with SIU and endourology and Asian gave me the opportunity to visit so many countries in the world, and where almost everywhere. And I've been to Japan. I've been to Russia also. And Russia, I did a one partial nephrectomy robotic. And I've been to China. Singapore, came many times, many times. And then, so that's how the journey been. Because of the large volume which we had of a stone disease, we could do many innovative procedures. I mean, with Glenn, we have done the different type of new flexible ureteroscope we have tried out, and we have used it in a patient, did a data, and then analyzed it, and then published it. And so this is how we've been trying to improvise the treatment so that there is a good outcome and no complication. My first thing was a complication-free surgery, safe surgery. And then even so many talks I've been given, which was again mostly on prevention of a complication. How can you risk reduction strategy and do no harm? Such a topics we had.
I mean, Mahesh, you have been amazing. And the way that you are so passionate about what you're doing, you're full of energy, you're still a young man, and you contribute so much, not just to Asia, but the international scene as well. Mahesh, I've seen your awards you received from the international urological community. I'm so impressed. I mean, after you've hosted and organized the World Video Urology and the World Congress of Urology, you became the president of the World Endourology Society. You were also chosen to be president of SIU. And you know, the number of awards you received would include things like the Lifetime Achievement Award from Endourology Society in 2014. You were given the AUA Presidential Citation in 2012. You were made honorary member of AUA in 2023. Very rare. And of course, you were invited into the prestigious group of GU surgeons since 2003, and you received the Spence Medal from the GU surgeons in 2023 in recognition of your fantastic achievements. And we're all so proud of you, and we're also impressed by your achievements and also by your energy, but most important, by all your friendship.
Yeah, Michael, thank you for that. But I believe that once you decide that you want to do something, because as I told you earlier, my mother's untimely passing away was the first stimulus. But then Nalini was my classmate in college, and then we married, and she's been anesthetist. Anesthetists are, they're the head of the table, and they watch you operate. And then she used to say, you should have done this, or you should do this, or, because PCNL was a new thing, and she was equally involved in the surgery. And I think she was my critic, and she was my mentor in correcting me, and then she was taking care of the patient. And that was the most important. And then I never bothered about the finances and part of it, but she was managed it very well. I think without her support, I would not have done it. And then my son, he also was brilliant in studies, and then he became a urologist, and he went to the Cleveland under Dr. Gill to learn. And then he is still with him, and he is the one who taught us the laparoscopy and robotic surgery to do that. And he still comes 2-3 times a year to the hospital and does the teaching. But one of the most important thing I feel that I got all this achievement is because of my hospital. Because the teamwork which we had, the amount of things which we produced, more than 500 presentation, more than 300 papers we have presented, all that thing and that research, and and that my students and my staff, they've been Sabnis and Arvind and Abhishek and all that people, we are together, we could achieve all this thing. That's how we have got this recognition. But I'm very glad that I become a president of the SIU and Endourology, because only Indian who become president of the two. But I could utilize that in promoting endourology and urology, not only in India, but all over Asia and in the world, And this is the best thing could happen is the opportunity. But I think with opportunity, determination, and encouragement from the people around, you can go places. Thank you.
Yeah, you got a national award from the president from India itself, and it's called the B.C. Roy National Award. Please tell me about that.
That was the first recognition, 2001. Around, and then that was Abdul Kalam was a fantastic president we had, and he gave me the B.C. Roy Award for developing the specialty in rural India. That is how I got it. And when I went there, he asked me while they were giving the present, okay, how did you get the donor for your transplant? He knew everything about me. And then if you see my picture, which is behind, he said, turn like this and you'll get a good picture. I mean, he was president, but he was down to earth. And I felt so elevated. And I think one of the best award which I could get is from the president. And that was fantastic. And second was the Lifetime Achievement Award, which I got from Endourological Society. I was in Taiwan, and that was thing. Then again, geosurgeon, the Spencer's Award, again for developing the urology in the worldwide. And geosurgeon has been very stimulating. and where we meet all those people. I mean, that is a highlight of my life at the moment, because I meet all the friends, especially Glenn and Jody, and we spend time for few days together, and we have a great, great fun. So in all this awards has been, even though it is given to me, but let me be humble enough to tell you that it is because of the hospital where I work, where all the people who helped me to achieve this. Thank you.
Well, the team is definitely privileged to have a great leader like you, and we are all privileged to have such a great friend like you. So it brings me great pleasure to call an end to this interview and wish you and your family all the very, very best, Mahesh. Have a good
Thank you,
day.
Michael. Thank you.